mammogram that's causing breast cancer. It's not saving lives. You have a 4% increased risk of dying if you get mammograms, period.
One series of mammograms is equivalent to the radiation dose of 1,000 normal chest x-rays or spinal x-rays.
That
huge. Means when a woman goes in, and look, how often do the doctors say, you need to go in for regular mammograms, you need to go in, and it used to be over 40, but now they're saying they're wanting women to go in at 20 for yearly mammograms. So let's say, no wonder breast cancer is so prevalent right now, and now you have women that are doing double mastectomies to prevent breast cancer in the first place, but
just because of
radiating tissue is what you're doing. You're radiating tissue.
If a woman follows the 10-year protocol of getting a mammogram every year or every 6 months, she is getting as much radiation as a woman had at Hiroshima, the atomic bomb, if she stood a mile away from the epicenter.
Is there evidence that mammograms can cause cancer?
Well, there is evidence. In fact, there is a study that came out of London, England, and it showed that women who have mammograms, they have higher rates of cancer than women who don't get their regular mammograms. And the latest evidence is even more striking. It showed, there's a report, that was actually partially released by the FDA, and it showed that the radiation that is caused by mammograms and CAT scans and full body scans, the radiation is so intense that you're likely to develop cancer. That is a great likelihood to develop cancer the more radiation you get. And for one mammogram, they're comparable to about 1,000 chest x-rays. So you have a couple of them, it is like standing next to a nuclear bomb exploding. That's the amount of radiation you get. Radiation has been known for a long, long time to cause cancer.
Mammograms cause a lot of problems. The compression, the radiation, the studies have shown that they can increase your risk of cancer.
Mammograms cause breast cancer, period. So mammograms are not healthy for women. Women should not be getting routine mammograms. That's crystal clear, published in the peer-reviewed literature. And yet today, if a woman went to her gynecologist or family doc, she would have this shoved down her throat, extreme coercion to go get this mammogram that's causing breast cancer. It's not saving lives. You have a 4% increased risk of dying if you get mammograms, period.
So the detection technique that we're using, the primary technique that we use to detect breast cancer, is causing breast cancer?
Absolutely. It's a terrible test, smashing women's breast and then irradiating with cancer-causing irradiation. And then it's so insensitive. For women under 50, it's only like 52% effective, sensitive. That means 52 is pretty close to 50, right?
Yeah.
So about half. That means that half the women that have breast cancer, it would not detect their cancer. That's a terrible test. And so there are much better tests, and yet this is what's still being crammed down women's throats today. Terrible test, causes breast cancer.
X-ray radiation, which is targeted, and in mammograms, you have a massive dose of that going to a very, very small area of the breast that is extremely damaging. The mammograms themselves, they squash the breast. The first thing that a doctor learns when you study medicine is don't gently touch the breast, never squash them, never press them, never push them, never treat them harshly. And they put their plates against them and then radiate them with this massive dose of radiation. It's not surprising that mammograms are now one of the leading causes of cancer. In fact, they found that 3 million people die each year from the radiation produced by the diagnostic tests.
3 million?
3 million people each year die from the radiation. So that is about 50% of all death from cancer.
Painful compression of the breast. If there is a cancerous tumor in your breast, may literally spread cancer. And remember that mammogram uses ionized radiation, and radiation known to cause cancer. The premenopausal breast is highly sensitive to radiation. Each annual mammogram exam increases breast cancer risk by 1% or more. Danish Medical Association published the scientific basis for mammography screening is very uncertain. We cannot exclude the possibility that screening does more harm than good.
And the newest study that came out in Canada, it was a 25-year study where they found that mammograms did not decrease breast mortality rate at all. In fact, they were just as effective as a self-breast exam that women do.
Canadian study was also showing that mammography is not beneficial and can increase the possibility of breast cancer by 52%. Lancet Prestige Journal was publishing that screening with mammography is unjustified. No decrease in breast cancer mortality. Actually, it's increasing possibility of breast cancer by 4%. Dr. Makhtar said, our data shows that there is no evidence of a positive effect of the mammogram screening on breast cancer mortality at the population level over the observation of 40 years.
That's why I recommend women do thermography instead of mammograms.
So much safer. Thermography is not emitting ionizing radiation. It's simply detecting the natural infrared light rays, or invisible light rays, that your body is giving off. But on this point of mammography, this is really crucial because we've also reported on this extensively. Mammograms, as they are recommended and conducted today, harm 10 women for every 1 woman who is ultimately helped by them. Most mammograms are actually causing false positives. There's so many cases of false positives where women have been told, hey, you have breast cancer. If you don't do something now, chemotherapy, radiation, surgery, mastectomies, if you don't do something now, you're going to die in 6 months. And from this state of fear that oncologists use kind of like a recruitment weapon against women, many women succumb to that fear and they give in and they undergo treatment. There was a woman in Canada that just happened recently. She did, I think, 3 rounds of chemotherapy. She had liver damage, heart damage, kidney damage. She lost most of her muscle mass, her hair fell out, and then her oncologist admitted he made a mistake. She didn't have cancer at all. So a lot of what's going on in the cancer industry is based on false positives, and it's using mammography as a system that actually gives you cancer because it irradiates your breast tissue, it irradiates your heart, and it irradiates your lungs. So don't ever think that mammography is only detecting things. It's actually giving you cancer at the same time.
Absolutely. I mean, radiation has been known to cause cancer.
By the time they see a lump on a mammogram, it's taken 5 to 8 years to develop.
Let's look at the life of a cancer cell. So day 1, you've got 1 cancer cell. It takes about 90 days to get the second one. Some are slower growing than others. But it's not until around 7 or 8 years until standard medical imaging and testing can detect it. That's why so many times it's too late, because that is 4 billion cells. So let me help you get an idea of this. A half a centimeter, that's about 1 billion cells. A centimeter, that's about 5 billion cells. So that's about 1 centimeter is about as small as standard imaging, MRI, CT, ultrasound, CA test can detect a cancer. Many times that's too late.
So if we put mammograms aside and we look at the technology with thermography, which has been around for years and can detect physiological changes at a very early stage, wouldn't you rather know that there's possibly some changes going on in your breast or in your abdomen 5 to 8 years before you have a diagnosis? And with thermography, there's no pain, there's no compression, there's no radiation. It's just a beautiful tool to have in your pocket.
Wow. So it's not only less invasive, but it works better. It detects earlier.
Absolutely.
What better options are there for detecting breast cancer?
Well, there's two better options. If you've got a lump, if you think you've got something, ultrasound is great. It's a test of anatomy. Mammograms are tests of anatomy. Ultrasounds are tests of anatomy. MRIs are tests of anatomy. So if you've already got a lump, you want a test of anatomy. So that would be like an ultrasound, because they can see the lump, they can see its consistency, they can see whether there's calcium in it. And they can look at blood flow, because tumors are going to have increased blood flow. So for instance, the sensitivity of ultrasound is up around 80%. It's much higher than mammograms, and the sensitivity is higher too. But if you're looking about prevention, if you're talking about screening, there's really only one device out there, and that is thermography, an infrared thermal camera. Nothing touches the lady, nothing smashes her breast. There's no cancer-causing irradiation. As we sit here, we are emitting heat in the spectrum called infrared. Okay. There's infrared, visual, and ultraviolet. So this is the infrared spectrum of light, which our eyes don't see, but which is very detectable by the cancer. The military developed this so that they could see people sneaking at them at nighttime, and so that they could shoot down missiles and things, because they're producing heat.
Sure, like the night vision goggles.
There you go. Night vision goggles are infrared goggles. So we use this as a medical application to detect hot spots in the breast. Well, long before there was a tumor there were cancer cells. Probably 8 to 10 years before there was a tumor, there were cancer cells starting to grow. 2 cells, 4 cells, 16 cells, 144 cells, etc., etc. And it takes about 8 years until you get to about a centimeter in size for a mammogram or an ultrasound to detect it. Well, that's too late, because that 1 centimeter tumor, about 5/16 of an inch, less than half an inch, is about 1 billion cells. When you get to 1 billion cells, the cancer has already eroded into the lymphatic system and the venous system, and it's shedding cancer cells all through the body. So that's why mammograms, one of the many reasons mammograms don't save lives, it is not early detection. And that's one of the little lies they propagated along. Early detection saves lives. Get your mammogram today.
Right.
Well, that statement's true. Early detection does save lives. It's just that mammography is not early detection. It's too late. And then the cancer-causing radiation. So the long and the short is, you're causing much more breast cancer with mammograms than you are detecting.
You're saying they should be using thermography instead of mammography. It's a better early detection technique. Why, in your opinion, are they not using it if it works so much better?
You know, there are things that you just want to shoot yourself over, that the medical, standard medicine, I've come to believe that American medicine is not about helping people get well. It's about managing disease and selling drugs and creating money through the paradigm of patient treatment. So you can't talk about cure. You can't look at getting people well from cancer. They just want to treat them and then watch them die. It's really a pretty pathetic state of affairs. So we are not interested in standard medicine and getting people well, just managing their disease until they die.
Well, that brings us to the multi-billion-dollar cancer industry, and mammograms are part of that. I mean, you look at the Breast Cancer Awareness Month. I mean, they're not teaching women about true prevention, but they're running women to having more mammograms. And to change that around is going to take some time and some persuasion and some education, which in the 10 years that I've used thermography, I've seen a tremendous growth in that industry. And again, it's awareness and education.
But at the heart of it, though, it sure appears to be financially driven.
Absolutely, as the cancer industry is.